Okay, my name is Hannah Karr, and I am going to be completing the exercise assessment and prescription lab examination. So I'm going to start with talking about the different sites for skin fold measurements, and we have 7 sites, 8 sites listed in the book, so I'll just go over all of those. The first site that I wanted to go over is the chest, and the chest is going to be a diagonal fold that is next to the armpit fold. However, the diagonal fold should be pointing towards the nipple when you take it, and it'll be diagonal like I mentioned. That's the first site. The second site is the mid-auxiliary fold, and that is directly under the armpit, but it's lined up with the bottom of the xiphoesternal joint, which is the bottom of your sternum. So that should be right in line with that, directly under your armpit, and that will be a horizontal fold. The next skin fold that I'm going to talk about is the suprailiac fold, and that again is going to be directly under the mid-auxiliary fold. So when you mark that on the body, just continue down until you reach the top of the hip bone or the ilium, and that's going to be a diagonal fold. And then the next fold that I want to talk about is the abdominal fold, which is going to be 1 inch over and about 1/2 inch down from the navel. And that will be a horizontal fold, as you can see just by pinching right here. The next fold is the thigh fold, and I don't know if you can see that, but it's marked about right here, which is about halfway between her patella and the hip bone, and that is going to be a vertical fold. And then we have the subscapular fold, which is a diagonal fold, and it's going to be right at the bottom of her scapular border. And again, that'll be a diagonal fold on the right side of the body. And then we have the triceps fold, which is on the posterior side of her arm. Again, that will be a vertical fold, and it'll be about halfway between her elbow and the top of her shoulder. So it'll be right here, and you'll just grab a vertical fold like this. And then the last fold, which we didn't talk about in class but is mentioned in the book, is called a medial calf. And if you could turn, Kaylee, that is going to be measured right here. It's about 1/4 of the way down between her patella and her ankle on the medial side of her right foot. And and that'll be, I believe it's a vertical fold. And to get the best measurement on that, the book suggests to have your client be sitting down with his or her foot in bent in a 90-degree position. So those are the 8 folds named, and how you measure them. So now I'm going to be demonstrating how to actually physically take a caliper measurement on a subject. I'm going to be doing 3 skin folds. I'll be doing the mid-auxiliary, the abdominal, and the triceps on my subject. I just want to go over the protocol so I don't have to put her in pain while I'm doing this. So basically, first with a skin fold measurement, you're going to be, like I did, I marked on my subject the little X's to make sure that I was measuring the right spots, because I am not a professional at this, and I didn't want to take it in the wrong spot, which would negatively affect my results. So I marked the spots on my subject where I wanted to take the skin folds. And then I just wanted to feel around her and make her comfortable with me touching her, and me comfortable with my body position regarding to her. And then so the next step is actually firmly grasping the skin fold. So I would grasp the skin fold away from her body, and then make a fold that was parallel on both sides of it. And then I would take my caliper with my right hand, with holding the fold with my left hand with my thumb and my index finger, and I would put the caliper not too deep and not too close to the edge, but right where the fat sort of differentiates from the muscle. and put the caliper about 1/2 inch to 1/4 inch away from my hand placement, so my hand pinching the fold wouldn't negatively affect the results of the caliper. And I would just squeeze down as far as it could go. And then I would afterwards take the caliper off and let my hand go, so the fold went back in the position on the body, and I would read the caliper 4 seconds after I removed it from the skin. And then I would repeat that process 2 times to make sure that my readings were within 10% of each other. If they weren't, I would retake it and try to get a more consistent reading. So I'm going to demonstrate now on my subject. The ones that I'm going to do again are the triceps, the mid-auxiliary, and the abdominal. So I'll start with the triceps. The tricep fold, I'll just have you turn around, is again like on the back of her arm, about midway from the elbow to the shoulder, and it is a vertical fold. So I'll just take it and grasp the skin, trying to pull that fat away from the muscle, and with my thumb and my index finger, my left hand, take my caliper, making sure that the measurements is towards me so it makes for easy reading, and place the caliper 1/4 inch to 1/2 inch away from my fingers and squeeze down. Then I would release, and I would get around 35 millimeters. So I'm going to repeat that, making sure that 15 seconds pass between each measurement so the body has a chance to reorient itself. So I'd take it again, firmly grasp the fat away from the muscle, measure the fat, fold, release, and I would get around 32. So those are within 10% of each other, so that's fine on the consistency reading. The next fold I'm going to be doing is the mid-auxiliary fold. I'm just going to pull it up a little bit. Again, directly down from the armpit and coming over from the xiphoesternal joint. This is a horizontal fold. So I take it, grasp with my thumb and my index finger on my left hand, pull the fat away, 1/4 to 1/2 inch away from my thumb placement, get the reading, 4 seconds, and I would get about 17. So I would wait 15 seconds between the next measurement. 15 seconds passed. Repeat. Get about the same, about 17. The next fold that I will be demonstrating is the abdominal fold. And again, this is going to be about 1/2 inch away to the right of her navel and 1 inch to the right of her navel and 1 inch down. And this is a horizontal fold. So I'll repeat the same process that I've been doing, thumb and the index finger of the left hand, firmly grasping and pulling the fat away from the body, and then measuring with my caliper. So there I got about 25. So I'll repeat this process, letting 15 seconds pass between this measurement. Pull away, measure, and there I got about 22. So those are within 10% of each other, and those are the 3 folds that I chose to demonstrate. Again, all of these folds should be on the right side of the patient or the client's body, not the left, just for consistency. So now I'm going to be talking a little bit about a muscular endurance test that we learned about in class. The one that I chose to comment on is the push-up test, and this can be used as a strength or an endurance test. Strength would just be how many pounds he or she can push up in one repetition. However, for the endurance test, you just continue on until the client is at a point of exhaustion, and then however many push-ups he or she can do in the correct form is her muscular endurance score. So the push-up test is going to be measuring the endurance and the strength of their upper body muscles, which is your deltoid, your pectoral muscles, your triceps, your biceps, etc. So for this test, you want to make sure that for every client, they are in the correct position. So for a woman, you want her knees to be, or her weight to be distributed on her knees and her arms. For males, usually it's on the tips of their feet and the arms. However, make it a little bit easier for girls. So for her, I want to make sure when she's doing this that her back is rigid and her body is straight and maintained throughout the full contraction and extension of her muscles. I also want to make sure that her toes are curled and that her arms are about shoulder width apart. And for her, since she's putting the majority of her weight on her knees, I would like her arms to be a little bit above her shoulders in the up position, so that when she goes down, then her arms would be directly below her shoulders in the down position. And so for me, the administrator of the test, when I do this, I would just put my fist right under her chest. So each down, she would touch the top of my hand and then go up in a straight motion, keeping her back rigid, her body straight, her toes curled, and her arms in the same position. Again, I would just, for the endurance test how many push-ups she can do until she is maxed out in endurance. So I don't really want to put her through that, so I'm just going to demonstrate one push-up in correct form, and then you can assume the rest.
Okay. Nice.